Good morning, colleagues. A very warm welcome to you all to today's session on the food industry. A warm welcome from the National Institute for Occupational Health and the National Health Laboratory Services. The National Institute for Occupational Health is a complementary division like the NICD that many of you may be familiar with. And today's session is a particularly important one, and we've been receiving a lot of queries from the food industry. And we're very fortunate to have three panelists joining us from the Department of Employment and Labor, the National Regulator for Compulsory Standards, as well as Food Control from the National Department of Health. So during the session, you will be muted. So kindly put all your questions in the Q&A tab or the chat box. Can I get some indication if everybody can hear me clearly? Because I see there's someone that's saying they can't hear me. Glenn, can you just check? Okay, great stuff. I'm going to hand you over to our program director, Mr. Ashraf Ratcliffe, and he will take you through the proceedings for today. Over to you, Ashraf.
Thank you very much. That was Dr. Tanusha Singh, the chairperson of the NIH's COVID-19 outbreak response team. And our session today, as she's announced, deals specifically with the food industry. And we've got a number of our colleagues at NIH and the guest presenters helping out today with the various topics. The first speaker we will have is going to be Dr. Odette Volmink. I know we had Dr. Ndaba, our colleague Mpumi, on the program. We've made a swap there. And our second guest will be, Odette will be dealing with COVID-19 update as well as return to work screening and procedures to follow for COVID-19 positive employees. Then that will be followed by the required precautionary measures for COVID-19 in the food industry. And we're honored to have Mr. Warren Mullen here from the Department of Employment and Labor, who's going to deal with that particular aspect. That is followed on the question of food control, and Ms. Penny Campbell will remotely log into our session from the National Department of Health dealing with food control. Then finally, before our question and answer session, we've got the regulations of chemical disinfectants and respiratory equipment. That will be dealt with by Ms. Tando Magolejo from the NRCS. And I now encourage you to please use the chat bubble at the bottom of your screen, approximately there, I think. And just please add any questions you have on the sessions or those presentations, as well as for those who require the CPD points, please, you can put in your details, including your CPD professional number there. Alternatively, if you don't do that in the chat box itself, you can email it to info@nih.ac.za, info@nih.ac.za. So without much ado, I'm handing over to my colleague, Dr. Odette Volmink.
Good morning, everybody. Thank you for joining us today. Just going to wait for the slides to come up on the screen. So today I'm going to be speaking a little bit about COVID-19 updates, and then I'm going to be talking a little bit more to return to work procedures and medical screening. Thank you. So now this first slide is just some websites that you can use, because we didn't know COVID before about 4 months ago. So this is a rapidly evolving topic, and even the guidelines are rapidly changing. So please keep informed. There's the NHLS website, the NIH website, NICD, the National Department of Health website, the WHO website, the CDC, please keep up to date by reputable sources. Hi, Glenn, can you help me change the slide? Oh no, just change the slide. Sorry, we're just having some technical issues, and we'll just try to move this to the next slide. Okay. So with regards to the global statistics as of yesterday, as of yesterday, we have more than 3 million cases, confirmed cases of coronavirus, resulting in 255,000 deaths. But we've also had some recoveries. More than 1 million people have recovered from COVID disease. Within South Africa, our numbers are growing rapidly. And as of this morning, we had 7,572 confirmed cases and 148 deaths. But we're also seeing a gradual rise in the recoveries as well. So a lot of the information about COVID, I know we're getting from the media, we're getting from even social media, the TV, we're bombarded with information. So this is just really to recap a bit, that in terms of spread, we know that it's spread by droplet spread. So when these droplets are generated when we talk, when we cough, when we sneeze, and they actually are suspended in the air for a little while, and then they fall to the ground after a bit, and the larger droplets fall to surfaces in the ground. And that is why social distancing is so important. So we are outside of somebody's breathing zone, because these droplets suspended in the air, people inhale the droplets, and then they attach to receptors in our body, and then we can become infected. We also can be infected when we touch either an ill person or a surface that has been contaminated with the virus. Now, what we know about the virus is that it has quite a fragile outer membrane, and this is less stable in the environment, so it can be killed by simple disinfectants, which is good. But the survival time in the environment depends on many factors. And so there's different times for different, depending on the surface that the droplets land. Also, it's dependent on the pH of the environment, how long the survival time is, the inoculum size, so how much virus is actually in the atmosphere at the time, the dryness of the environment, the temperature of the environment, as well as the exposure, their environment's exposure to disinfectants. As we know, common disinfectants like 70% ethanol and bleach are able to kill the virus. So if you see that little slide at the bottom that shows gloves, and these are, some studies have shown that surgical gloves could last for up to 8 hours, aluminium up to 2 to 6 hours, wood up to 4 days. So it's very much dependent on the type of surface that the droplets fall onto. Now, COVID-19 is normally people who have been exposed to the virus, the coronavirus or the SARS-CoV-2 virus, have a period of where they are symptom-free, an inoculation period, and this can be from 2 to 14 days. And that is why there's a recommendation of 14 days after exposure to see whether or not somebody would develop symptoms. These symptoms include the common ones of fever, cough, shortness of breath, and sometimes a sore throat. But there are other symptoms, and these can include muscle pain, nausea, vomiting, diarrhea, abdominal pain, headaches, runny nose, as well as a loss of taste or a loss of smell. Okay, so the NICD, which is the National Institute for Communicable Diseases, investigates, calls a potential patient, a person under investigation, when they present with a respiratory illness of at least one of the following symptoms: either a cough, a sore throat, shortness of breath, or a fever, which is diagnosed as more than 38 degrees Celsius. People who exhibit these symptoms will then be tested for coronavirus. And these tests are normally an oropharyngeal swab or nasopharyngeal swab, which is basically, it looks almost like a swab that they put to the back of the throat, to the back of the nose, and this is then tested for coronavirus. And will confirm if somebody has, coronavirus. So now, it's important to note that within the food industry, it is highly unlikely that COVID-19 will spread from either food or food packaging. And this is because there's no evidence to date that respiratory illnesses can be transmitted by food or packagings of food, and the coronavirus is not known to multiply in food. They need an animal or a human host in order for this to multiply. So within the workplace, in all industries, including the food industry, is that we can have exposure coming into the workplace. We can have exposure either from a worker who is within the community, is in contact with someone who has the coronavirus, and then comes into our workplace, and they infects other people within the workplace. Or in some situations, you can have occupationally acquired COVID disease. When a worker gets COVID-19 because they are working with either the COVID-19 specimen in a lab setting, or they're treating patients who would be infected. But even in the food industry, we can get it can come into our workplaces from our workers and our customers and our visitors who come into our workplace who may be infected. So now just looking at what our usual occupational health mitigating factors are in the workplace. We normally try to do primary prevention, and primary prevention looks at preventing people getting the disease. So trying not to expose people to the disease. And if they are exposed, to minimize the risks by putting controls in the workplace so that people don't get to the point where they actually are diseased. And I know we know a lot of this, and it's revisiting our usual practices to minimize the risk of transmission in the workplace. So looking at redoing our health risk assessment, looking at the controls that we have in place, looking at the hierarchy of controls, and as a last resort, PPE. We also need to look at our policies and make sure we have policies and SOPs in place in order to mitigate the risks that are caused by COVID. We also need to ensure that our employees are educated and trained around the possible risks and the controls and what is expected of them within the workplace in order to ensure that we exercise primary prevention so people don't get the disease in our workplace. The next step is also, and oftentimes it's where there are some primary prevention has failed us to some extent. Here we need to make sure we have strategies in place to pick up disease early when there has been a disease. And we need to identify persons that are at risk and respond immediately. And one of these strategies is to do medical surveillance in high-risk situations. In terms of tertiary prevention, this is when somebody already has the disease and to prevent further complications from the disease. And here we look at rehabilitation and how we need to respond appropriately when there's a case of COVID amongst staff, looking at incidence investigation and contact tracing. And where applicable, if it's an occupationally acquired disease and compensation is appropriate, to go through the proper channels and fill in the appropriate documentation and provide people with the appropriate leaves as well. So in terms of looking at workplace preparedness, we do need to look at our risk assessment again. And we need to look at all our operations. We need to look at retail and display. We need to look at the manufacturing with regards to food manufacturing, and also the production of food as well as the selling, retail, and the displays. We need to look at each of the activities and do a risk assessment for each of our activities, and not forget about shared spaces. In terms of administrative controls, we need to have a workplace plan in place. People need to have clear infection prevention and control strategies and policies and use standard precautions. We need to look at administrative controls regarding controlling access to our factories, our retail stores, to avoid overcrowding of high-risk areas. We need to look at our workplace facilities and look at what needs to be in place. We need to look at access control. We need to ensure that there's enough spacing around our staff. We need to limit the size of meetings, avoid mass gatherings, as we know. And we need to ensure there's proper signage and risk communication, not only to our staff, but also to our visitors within our workplaces. We need to review the cleaning and the disinfection material to ensure that it covers, it is effective against SARS virus, or rather the coronavirus. And we need to ensure that there's proper supplies and there's procedures to get these supplies. We need to look at, are we in line with established public health reporting procedures? And we need to make sure there's also other guidelines and action plans and protocols for confirmed cases, when to be away from work and when to be back at work. So with regards to when is medical surveillance appropriate in line with COVID-19, medical surveillance is always risk-based and ideally determined at the guidance of the OMP according to the legislation. And in this case, it requires early detection, or it allows for early detection of the infected employees so that people are removed, infected individuals are removed from the workplace and isolated so that they can be referred appropriately for treatment and care and ideally come back to work within the appropriate time. It also allows for prevention of spread to unaffected staff, consumers, visitors, and clients that we deal with. This prompts identification and isolation and quarantining where necessary, and if this infected person has been in close contact with other staff, contact tracing needs to be done, and there needs to be effective return to work practices, and maybe even workplace restrictions when they do come back to work. So in terms of medical monitoring strategies, there are many different kinds of strategies that can be provided within a workplace. There can be self-monitoring, and this is often used for people who are not so at risk of getting COVID in the workplace, where employees are educated to look for not only fever, but also for symptoms in themselves, and then report on this. Should there be any symptoms that is worrisome, they need to have a plan of who to report to should they develop symptoms. But more often than not, we employ active monitoring, where there's regular communication between workers with regards to fever, with regards to symptoms of COVID, which are the cough, the shortness of breath, the sore throat, the body pains that we spoke about earlier. And communication is quite essential in this process. And a delegated either an occupational health staff member or even an infection control person needs to be responsible for checking these things. So those are the two main strategies. And in terms of medical monitoring, there are different types of screening that can be looked at with regards to COVID. Particularly the screening that is often recommended is the symptom questionnaire, where you look every day on a daily basis. People are monitored to see whether or not they're presenting with any kinds of symptoms. Temperature screening can be used, but it should be used with caution because it is dependent on different things, and oftentimes temperature can even be missed where somebody is positive but they may not have a fever at the time. So you could have an infected person passing through and not sort of being stopped by this process. People who who may be taking an aspirin or Panado or something to mitigate the fever may pass through and not be suspected of being infected. So it's important to not use this method only. Ideally, a combination can be used, but important to take account of whether or not somebody may be using drugs or maybe immunosuppressed and not presenting with a fever. This is just but one example of a screening tool that can be used, which records temperature of an employee, as well as the symptoms, fever, chills, cough, sore throat, shortness of breath. And daily, this can be ticked yes or no for each employee. So in terms of a recommended screening procedure, ideally, our health risk assessment must be done and also revisited around COVID. So that's always the start. But also with the directives that we've been given from the Department of Employment and Labour, we've been encouraged to, at the start of every shift, screen our workers for symptoms of COVID-19, which are the fever, the cough, the sore throat, the red eyes, the shortness of breath. And should an employee report any of these symptoms, ideally, if it is available, methods to screen even before people come to the workplace would be the ideal situation. These individuals, should they have any symptoms, should not even report for work. They should ideally go to their health practitioner and be assessed. However, oftentimes we don't have processes like that in place. And so monitoring would have to be done in the workplace. And when this is done in the workplace, if a person reports any symptoms, they should immediately be isolated. They should be provided with a surgical mask to limit their symptoms and their droplets for people in contact. They should also be transported for further medical intervention and possibly even testing. In the workplace, we need to assess the risk of transmission and disinfect the area where the worker made contact. And on receiving the results, if an employee is tested, the health professional should ideally notify the workplace, or the workplace should actively seek the results. These cases all need to be notified according to the NICD guidelines, because it's a notifiable disease, and contact tracing in the workplace needs to be done. We need to have protocols in place in the event of a symptomatic person being referred. We need to have protocols in place for when we have a positive employee in the workplace, and we need to have return to work protocols in place for people who have been infected away from the workplace and now coming back to the workplace. So with regards to a worker who is positive, who has a positive COVID-19 result, these people should have sick leave allowed to them. These people should self-isolate at home, and the area should be disinfected. We must ensure that this is notified to NICD. If it is occupationally acquired infection, this needs to be notified to COIDA. Within the workplace, incident investigation needs to be done to see who has been in contact with that infected worker in the workplace, and contact tracing needs to be done in the workplace to ensure that other people are not symptomatic, people who have had contact with that infected employee. And then we need to think about return to work once that positive the patient who has been positive with COVID-19 is now better. So in terms of return to work, there's two strategies that have been described. One is a test-based strategy, which basically says that a person should come back to work when they have complete resolution of their fever and they're no longer taking fever-reducing medication, as well as they have an improvement in their respiratory symptoms. Also, they need to have 2 negative results done 24 hours apart. That's the test-based strategy, but there's also a non-test-based strategy that says that a person can return to work as long as they've been recovered for 3 days. That means they have no fever, they no longer have respiratory symptoms for at least 72 hours. Or they have 10 days have passed since the symptoms first appeared. Then they could potentially go back to work. On return to work, it's important that a medical evaluation be done to see that they are fit to return to work, and the employee wear surgical masks at least 21 days. But in workplaces now, where we are routinely wearing masks, I think this becomes redundant. Also, people need to practice social distancing measures, hand hygiene, respiratory hygiene, cough etiquette, and continue to self-monitor for symptoms. Should symptoms reoccur, they need to seek medical attention. Just as a side, I thought it's important to talk about contact tracing, because this is something that we will be doing within our workplaces when some of our employees become ill. And so contact tracing needs to be done on any person who has had close contact with a confirmed case while they were ill. Now, it's important to know the definition of close contact. And this is face-to-face contact or close environments less than 2 meters apart. So this includes people who are living in the same household, or people who are working very closely within that 2 meters in a work environment. And it's important that the close contacts need to be self-quarantined if they are a close contact of a confirmed case for 14 days. They need to do temperature screening as well as symptom screening for those 14 days. They should remain at home and avoid any unnecessary social contact and be reachable. Should they have symptoms, they need to present to or call a healthcare worker or the NICD hotline for further information on how to be tested. It's important in our workplaces also to consider the vulnerable workers. Those are workers who have poor outcomes with COVID. Workers who are greater than 60 years of age, who have cardiovascular disease, diabetes mellitus, cancer, chronic respiratory diseases, chronic renal diseases, people who are immunosuppressed, possibly even HIV, workers who are diagnosed and living with HIV, but who are not virally suppressed. These are potentially high-risk workers. And so consideration needs to be taken for them in the workplace. And we need to look at their fitness for work. It's not saying that these people will be unfit to work. It's just that their level of immunosuppression and their control of their disease needs to be looked at together with the risk of work that they are doing with regards to COVID. Is it a high-risk workplace or not? So just to say this again, we need to minimize the risk of transmission in our workplaces. We need to screen and identify potentially affected employees and limit their contact and movements in our workplace. We need to review our health risk assessment, look at the hierarchy of controls, practice social distancing, promote regular and thorough hand washing by employees, by our contractors, by our customers, particularly in where delivery services. We need to think about other ways, maybe providing sanitizers where we have delivery of food. We need to encourage our staff and retrain on respiratory hygiene, avoiding touching your face while you're working. Our employees need to know about self-assessment of symptoms, what sick leave policies are in place, and they need to be encouraged that if somebody is symptomatic, they need to stay at home and self-quarantine. Thank you for your attention.
So thank you very much for that, Odette. And thank you for just cleaning up quicker. Much appreciated. And now I need to just introduce our next guest presenter. But to remind you, the chat box at the bottom of the screen, I think it's somewhere over there. You can click in there and please add any questions or clarification you require. But just briefly to introduce our guest speaker, that's Warren Mallon. He's a specialist occupational health and hygiene and specializing in a particular area of physical stresses, etc. I think he's also an occupational hygiene approved inspection authority. Technologist, there we go, thanks. Warren is assisting me from the side. And with a master's in public health in occupational hygiene. I'm not going to add any more, there's lots more to add, and ask Warren to join us. Thank you, Warren.
Thank you, Ashraf, and thank you to the NIH for inviting us here. So my presentation today, I'm going to look at what is required in terms of precautionary measures which are legislated in Occupational Health and Safety Act, as well as the regulations promulgated under that, as well as the directive notice which was published last week by the department. Okay, so just the contents quickly of my presentation. We're going to look at what the legislation requires. We're going to look at specific regulations and risk assessments, as well as updating the risk assessment, when to do that, the results of the risk assessment. Then we're going to look at specific legislated control measures. And then we're going to focus a little bit on the control of exposure, and then look at the COVID-19 outbreak, as well as social dialogue. Maybe before we get onto the legislative requirements, just to note that all the legislation that is promulgated under the OSH Act and regulations and the directive is a minimum requirement for an employer. So there's nothing wrong, there's nothing, or it is encouraged actually that employers actually do much more than what is legislated in the legislation in order to get exposure to as low as reasonably practicable. Okay, so just going on, so Section 8 in the OSH Act is very important. It talks about the duties of the employer, specifically Section 8(2)(d) of the OSH Act. It doesn't use the words risk assessment specifically, but the wording in that section does talk about the need to identify the hazards in the workplace. So it does say hazards, it doesn't specify which hazards, so it's up to the employer to identify all applicable hazards which are there. And it says that Precautionary measures must be implemented to protect both employees and visitors, contractors, whoever might be in the workplace. And then not only establishing those measures, they need to be provided as well and maintained and kept in good working order. So in talking with that section of the Act, there is also our general safety regulations, which Regulation 2, which also supports what is said in the Act about the risk assessment. Okay, then just briefly, all our legislation is available on our website. So at our website, labour.gov.za, if you click there on the top where it says Resource Centre, that will then take you to this next page where it talks about Acts Bill. So you can click on Acts there, and then you'll go there, and then you'll see Occupational Health and Safety Act, and then there is the Act available for you to download from our website. So just quickly, the specific regulations and risk assessments. So in line with Section 8 to D of the Act, the occupational health and hygiene specific regulations, which are there on my right-hand side, all of those regulations have a specific clause or regulation in the regulation talking about conducting a risk assessment. So regulations for hazardous biological agents is Regulation 6 for HAZChem, it's 5 for noise-induced hearing loss, it's 6. The ergonomics regulation, it's 6 as well, letter 6, as well as asbestos, it's 7. Okay, so also, again, at our website, on that resource center at the top, you can go to regulations, and then click on regulations again on the next page, and then click on occupational health and safety, and then you'll have access to all our regulations on our website. So let's continue with that. So those 6 regulations under occupational health and hygiene, they require the employer to conduct a risk assessment for hazards in the workplace, specifically related to biological agents, noise, ergonomics, which is physical, cognitive, as well as organizational ergonomics, as well as chemical agents. So that includes your lead and asbestos. Okay, so I've taken a little Photoshop of what the regulation for hazardous biological agents says with regards to what factors must be included or taken into account when conducting the risk assessment. So just reading what it says there, the employer must take in the following matters into account when conducting the risk assessment. So the first one is the nature and the dose of the hazardous biological agent to which the employee may be exposed to, as well as the route of exposure, where the HBA might be present and in what form, the nature of the work, the process, or any deterioration or failure in control measures, what effects the HBA can have on the employee, as well as the period of exposure. So as said previously, your risk assessment should include these factors as a minimum when you're evaluating the risk of a particular hazard in the workplace. There are similar requirements that are mentioned in those other regulations for those specific hazards as well. Okay, so when do we update a risk assessment? Okay, again, the regulations specify when exactly it must be done. So the first point is when the assessment is no longer valid, when control measures are also no longer effective, when there's technological and scientific advances in control methods, so they're more effective, or if there's been any change to any work methods, the type of work carried out, or the type of equipment used, or if an incident has occurred in the workplace. Where ergonomic risks, I mean, this was taken directly from the ergonomics regulations, but it's also similar aspects in all the other regulations as well. Okay, so updating the risk assessment continued. So if you hadn't previously had any identified COVID-19 in your existing risk assessment, then that implies that your current risk assessment is no longer valid, and therefore you need to update it to include COVID-19 exposure to employees. But while you are updating your risk assessment, you can also take this opportunity to look at other hazards which might have arisen as a result of the outbreak. So the first point there, new chemicals, you might be using different cleaning agents that you weren't previously using. So you've got to look at how those chemicals are also affecting employees in the workplace. Stress, anxiety, and depression. Employees are working in different situations now, so they might be exposed to longer working hours, burnout as well. So all those factors need to be taken into account, as well as any additional manual handling or awkward postures which need to be used. Employees might be doing different tasks which they weren't previously doing, as well as prolonged use of personal protective equipment. Okay, so your results from your risk assessment. So these are what should come out of your risk assessment, as well as what plans going forward, what you should do from your risk assessment. So it looks at monitoring. Does monitoring require? Do you need to take swabs to see if the cleaning and disinfecting was done correctly? Specific control measures. So we'll get onto those later, what is legislated. Programs to prevent occupational diseases, injuries as well. These programs are similar to plans which have been requested related to COVID-19. Medical surveillance as well, which has been touched on previously by Burdett. Your training and information, specific work procedures, as well as personal protective equipment. Okay, so what is legislated in terms of control measures? So yeah, the occupational health and hygiene regulations, they have a similar format for all of them. So they all look at training and information. So all the regulations prescribe a minimum content of what that training and information programs must contain when given to employees as well as visitors and that. So yeah, you can refer to our regulations for that minimum content. Also just a point with training information, it's not just a once-off, it also requires constant supervision. And that supervision doesn't only necessarily have to be by a supervisor, it can be from fellow employees, health and safety representatives as well. Okay, then also it talks about duties of those exposed. So those exposed includes not only employees, but visitors as well as contractors. They also have responsibilities, which are aligned with Section 14 of the Act, which is responsibilities of those of employees in the workplace. Okay, then the regulations also talk about conducting a risk assessment or looking at the exposure of assessment. Okay, then monitoring. Monitoring is just the quantitative assessment to determine what some exposure levels are. And some of the regulations require that monitoring must be done by an occupational hygiene and food inspection authority. Okay, then all the regulations talk about medical surveillance. Okay, as Adet said earlier, it should be risk-based. So that means that not everyone should do a blanket medical surveillance. It should be depending on what you're exposed to in your particular profession or your task. And the medical surveillance looks at your baseline assessment, your periodic and your exit, as well as the appropriate tests and examinations that must be conducted. Just one point, in addition to what Adet said about reporting to the compensation fund, just also remember that in terms of the OSH Act, there also must be reporting of occupational disease in terms of Section 25, to the Chief Inspector's Office. So that if there is an occupational disease diagnosed, an inspector can go to the workplace and investigate the occurrence of occupational disease to prevent it from reoccurring in that workplace. Okay, so just continuing on. Okay, so records need to be kept as well. The records specified are the risk assessment, your monitoring reports, your medical surveillance, reports, as well as your training records. And yeah, it also says for how long these need to be kept. So they vary from 30 to 40 years for your risk assessment, monitoring, and your medical surveillance, depending on regulation. But the time period for training, for keeping your records for training, is for the duration of employment of the employee. Yeah, these keeping of records is important because this information then feeds back into your review of your risk assessment as well. Okay, then also the regulations talk about the exposure, control of exposure, that is focusing on the hierarchy. We'll get into more detail that later. And then they all talk about personal protective equipment and facilities. So this refers to all PPE, not just respiratory protective equipment. So yeah, it stipulates that the PPE must be capable of preventing the exposure to whatever hazard it is. It must be correctly selected and fitted, and whether it's properly used and stored. So that includes where do you keep your PPE after the end of the shift, as well as laundering facilities, what is done, disposal of it, of the PPE if it's contaminated. Also talks about reaffirming that information and training must be provided on the use of that personal protective equipment, and it must be kept in good condition and effective working order. Okay, so the last one on the what is legislated in terms of control measures. Okay, then also what control measures have been put in place. They also need to be maintained in good working order as well. There's no point in just implementing a control measure and just letting it run its course with not keeping it in good working order. Okay, then some of the control measures specifically relating to engineering controls, more specifically your extraction systems. Those need to be tested and examined by an occupational hygiene and food inspection authority who is approved to do those tests and examinations. Then lastly, it talks about prohibitions. So yeah, you may not use compressed air for cleaning of any surface, particularly persons as well. A lot of places, they don't think they allow people to clean themselves with compressed air, but that is not allowed. And then also you may not eat, drink, smoke, or keep food or beverages in areas where there is exposure to particular hazards, particularly hazardous chemical substances and biological agents. Okay, so control of exposure. Yeah, there's been a lot of discussions and talk about the hierarchy of controls. So I'm not going to go into too much detail with it, but obviously if you can, you must implement elimination. If you can't do that, you go to substitution. If you can't, you go to engineering, then administrative, and PPE. But yeah, a point at the bottom there is, particularly with this COVID-19 outbreak, it's often a combination of control measures which are best applicable to getting control exposure to as low as reasonably practicable. Just example, some controls that have been legislated for COVID-19, if you look at extraction systems and ventilation, that is an engineering control. But then administrative controls is reviewing your risk assessment, limiting the number of people in the workplace, social distancing. Those are examples of administrative. And then you get your personal protective equipment, specifically your RPEs, your respiratory protective equipment. So you can see that's a combination. It's not just one control and then your hazard is going to be out of the workplace. Okay, so specifically what the regulations require in terms of control measures. Okay, so just remember this is a minimum that must be done by the employer. You need to limit the quantity of the hazard if that is possible. Yeah, so hopefully the constant sanitation, cleaning and disinfecting will limit the amount of the virus that is in the workplace. Limiting the number of employees. So that's been done by reducing the amount of people in the workplace. Limiting exposure. not everyone is working their normal shifts currently. Some people are on reducing shift. Okay, substituting for less hazardous hazard. That's not always possible. Process separation, automation, or enclosure. A lot of offices are now being turned from open plan to individual people's offices. Your local extraction system, as well as your general ventilation. Then also separating of different workplaces, again, providing access control to areas where, so not everyone has access to all the areas in the workplace, particularly where they handle specific hazards in a workplace. And then it also talks about you should develop work procedures. So how to safely handle, use, and dispose. So that would talk about to your protective equipment. Then maintenance, what work procedures for maintenance, and then as well as work procedures for cleaning, as well as disinfecting. Okay, so with regards to the COVID-19 outbreak, the Department of Employment and Labour, last week we promulgated a direction notice talking about occupational health and safety measures in the workplace. Okay, so this is also very similar to what is previously legislated. It just adds a bit more specific control measures specifically for this COVID-19 outbreak. It talks about what administrative measures to put in place. That social distancing should be implemented in the workplace. Symptom screening, which was touched on by Odette earlier, and then your sanitizers, your disinfecting, and other measures for the workplace. Then specifically about cloth masks, and then public access to the workplace, because you also need to have control over who enters your workplace. Then what ventilation requirements and other PPE. The direction also talks about reporting for employers that have more than 500 employees, submitting a planning and risk assessment to the Department of Labour. So as mentioned earlier, that's a minimum. If employers have less than 500 employees, there's nothing preventing them from also developing a plan and risk assessment and submitting it to the department as well. Okay, so just lastly as well, one aspect which I think is very important in this stage as well is social dialogue between all parties involved in the workplace. So that includes your employers, your employees, as well as their organizations, so that will be their unions. So the slide was taken from the International Labour Organization, from their Safe and Health Work Day from this year, actually, last month. So in terms of employers and employer organizations, they need to collaborate with government, and whatever requirements government has put in place is requested that employers comply with it as best as they possibly can. They need to communicate critical information to employees, because I think that creates a lot of confusion in the workplace as well, where information isn't shared as well. Review and draw up plans for the business, and then identify and mitigate risks of contagions for the employees. And then also promote workplace hygiene. In terms of employees and their organizations and the unions, they need to participate with the employer in terms of decision making and have inputs into policies and plans which are developed. They have responsibilities in terms of employees, so they need to, whatever lawful instruction is given by the employees, they need to, by employers, they need to, as employees, implement that, as well as wearing protective equipment correctly, and also following any preventative measures which are put in place. And then also strictly follow hygiene practices that have been adopted in the workplace. So yeah, just in conclusion, so at this time, yeah, employers should look at updating the risk assessment, but not only for COVID-19, but for other hazards which might have been introduced, maybe indirectly or directly into the workplace because of this outbreak. And then implement applicable control measures and maintain them as well. And then lastly, this is a collaboration. For these control measures to be effective, there must be a collaboration between employers, unions, and employees in the workplace in order for us to fight and reduce exposure. We did receive a couple of questions beforehand with regards to a few items from the food control industry. So I'm just going to go through those and answer them quickly as well. So the first question we received was, who supervises the deep cleaning and who gives sign off for the go-ahead? Okay, so ultimately, the responsibility of the workplace falls under the employer. Specifically, the OSH Act refers to Section 16(1), which is the Chief Executive Officer. That person is the accounting officer. So it's their responsibility to make sure that there is cleaning and disinfecting on the workplace, and that as well as it has been done effectively so that it won't cause harm to their employees or visitors, whoever might be in their workplace. So ultimately, it's the employer or the 16(1) that's responsible. That section of the Act, Section 16, does allow for the employer to delegate some responsibilities to a 16(2). So, yeah, the employer can delegate some responsibilities in terms of health and safety to another individual in the workplace who will then supervise all the current measures which are put in place in terms of COVID-19. Other questions that we received. It asks about whether or not all workplaces must be decontaminated before the staff return. So that would be the best practice, that in order, if you have during the lockdown stage 5, if there was no one in the workplace, it would be best that, or if you just had a few people in the workplace, few essential employees, it will be best to do a thorough cleaning and disinfecting of the whole workplace before there's a bigger influx of people, employees into the workplace. And then that's also just not a once-off. It's depending on how busy your workplace is, it can either be daily, more than once a day, that cleaning and disinfecting. And then should it be done in-house with appropriate health and safety measures in place? So yeah, the legislation doesn't prescribe who must do the cleaning and disinfecting. If you have internal cleaning staff, then they are able to do it as long as they have been properly trained and given the information, as well as they've been provided with the correct precautionary measures to prevent the exposure. If you do use an external company, then obviously in the contract between the employer and the company, those factors in terms of training, control measures must be stipulated in the contract of who's taking responsibility for the employees. Yeah. So yeah, that's all for my presentation. I think afterwards there might be some more questions and answers. So I'll be available for them as well.
Thank you very much. That was our guest presenter from the Department of Employment and Labour, Mr. Warren Mallon, dealing there with all the key aspects of what is required in terms of precautionary measures for COVID-19 in the food industry in particular. And I think there's one single point among so many that is made that I just want to pick up, and that is that new hazards may also be introduced when we deal with COVID-19. And so the sort of deep cleaning that you referred to and the decontamination questions at the end introduces the other chemical hazards, which are either going to be used in greater quantities or new chemicals. And that also needs to be dealt with in the risk assessment. Our next guest is connecting with us remotely, and that is Mrs. Penny Campbell of the National Department of Health, and she will be dealing with food control. I'm going to ask my colleague Glenn just to connect her, and if we can just confirm with her if she's online and if her microphone is unmuted. Mrs. Campbell, can you hear us?
Good morning, sir. Yes, my mic is unmuted and
Lovely.
It seems to be working from this side.
So we can hear you. I'm not sure what device you're using, as long as you stay close to your microphone in order for us to just be able to hear you continuously. Thank you very much. So thank you for joining us. Ms. Penny Campbell is the Director for Food Control at the National Department of Health, and she has her Master's in Public Health. We thank you for joining us today. We much appreciate that, Ms. Campbell. Can you see your presentation slides? Penny?
To you all, can you hear me?
Yes, we can. Can you hear us?
Right. I hear you. I just get a message that my internet connection is unstable. I'm not sure if that's within the department. But let us plot through the slides, because I think I only have 20 minutes and I usually have much passion for the subject that I want to talk and talk and talk.
Please proceed. Can you see your slides? Penny, can you see your slides?
And
Okay, you may proceed. Thank you.
okay, thank you very much. I was just saying that for the food industry, this is probably not new stuff to them. So the next slide is the definition of food control, because I was asked to just talk about food control, which can be a wide subject. And I thought I'd just put the World Health Organization's definition of food control, and you can read it to your leisure at a later stage, purely because of the time constraints that we have. But as I say, the industry is surely familiar with it. Next slide, please. Jeanette, the next slide. Okay, so in summary, by virtue of that definition that you've just seen, food control deals with food safety, food quality and composition, food labeling, as well as regulatory nutrition. And this is where all the health aspects of labeling come into being in terms of trying to make more healthier products. So as I said, food control is broad, but for this presentation, I will just try and hone in on a few aspects specifically relating to food safety. So this slide, if you just click it again, Jeanette, it will give you the final pillar. Jeanette, click again. Next slide, but click it twice. It seems to still have transitions in. Can you click it again? There we go. Thank you very much. So in summary, this slide is to explain to you the is by and large what is exemplified in many other countries. We call it a fragmented food control system, whereby the different Department of Health deal main with the food safety and the labeling and the regulatory nutrition. Agriculture has a role to play, and they deal in the main, and that's why you would have heard their minister speak on radio about food security when the lockdown was announced. The DTI has a few entities that deal with some of the aspects relevant to food control, as well as having an entity that actually deals with food safety for certain products. Next slide, please. So also then, what is the definition of food safety? And that's always important to deal with definitions when you're dealing with regulations. The definition in the regulation supersedes any other definition. And if there's no definition, then it would be what would the normal dictionary definition would be. So the World Health Organization sets its priority in terms of food safety. It has the mandate to deal with it, and its definition says it's the assurance that food will not cause harm to the consumer when it's prepared and or eaten according to its intended use. So we're dealing specifically with what the food does to the person. And you would have already heard from Dr. Volming that food or food packaging is not yet known to be a source of transmission of the coronavirus. Next slide, please. In this slide, you will see what we try to portray, that there's no one ministry responsible, there's no one department, there's no one industry responsible. It's a shared responsibility that's between government, who sets in place the legislation, the law and gives advice and education like we're doing here, the consumers, who ultimately are the recipients of the safe food that is prepared by the industry, which is the final pillar in this little house that we have. At the bottom, I'm not sure if it's cut off in your side, it's the global commitment to food safety, which is the WHO, and above that would be the foundation, which is set by a national commitment by a country to food safety, which in this instance, as I've mentioned already, is the Department of Health. Next slide, please. So at the outset, we were inundated with a number of queries after the lockdown was announced, and some departments had put forward information in relation to what services they were still rendering. And based on that, Food Control put forward this communique to the industry as well as to the EHPs. And you will see that the official date was only on the 30th of March, although certain facets of this was communicated long before this. But it was just to try and explain that although we had a virus that was creating disease in the country, and that there was a lockdown, Food Control was still paramount and important before, during, and will still continue to be of paramount importance after the lockdown. So there was no need for us to make specific regulations under the Disaster Management Act, and the regulations and Act provided specific guidance and still maintain that guidance in relation to food safety and food control aspects. So that letter was issued, and as I mentioned before, yes, you can go to the next slide. The food system is very varied and broad, and this slide just tries to capture what is commonly called the food chain, which starts with primary production with our farmers and eventually gets to the consumer at the bottom through that conduit. But it's not a linear process. It sometimes can go straight from the farmer to the food retailer, or it could go straight into food catering. And the two ministers that mentioned that the industry would come up was firstly agriculture, which, as I said, deals with food security. So they have mandate to tell us that the food industry, the farmers, and that would be the essential services that would continue during lockdown, as well as the industry, the food industry. As you would recall, the president said food will be produced, distributed, and supplied. That is this chain here. And you would have not heard our minister speak to food safety or food or anything like that, because we are just dealing with the effects on the human population and therefore the disease. And the ministers dealing with the food security issues had then announced that food was going to then be in the system. But as indicated, we had already communicated that despite that, food safety was still paramount and Food Control still need to continue through this process. Next slide, please. So the other thing that I just want to also mention with that previous one is you would also recall that for you to operate as an essential service, you needed to register with the Department of Trade and Industry for you to operate. So your CLA, which is what I'm going to cover now, was not the rationale for you to be an essential service during the lockdown. So these are the basic regulations. Just go back a bit, Jeanette, sorry. The basic food safety requirements are captured in our regulations governing general hygiene requirements for food premises and the transport of food. They were updated in 2018, and they replaced the 962 of 2012 and the old R918 of 1999. Thank you. Next one, Junior. What has changed with those regulations? Firstly, we have ensured that we looked at the science, given that they were originally published in 1999, have they kept abreast of the science? And in particular, we ensured that we aligned it with Codex. And one specific example is the 5 keys to safer foods, which I hope you all remember. The immediate tenet from those 5 keys, the first one is to keep clean, and that is the critical message that we've been trying to send out throughout this whole thing around the COVID in terms of preventing spread, is keeping clean. And there's been caveats of that being said with the previous presenters as well. The other additional updates we looked at was to look at modifying some of the definitions, deleting some outdated ones, as well as deleting sections that were no longer relevant. We also tried to move some of the regulations to ensure that there was clarity in relation to certain aspects, because sometimes you have something saying in spite of regulation XXX, da da da. So we tried to make sure that we tried to put all things that dealt with certain aspects together. We also then included hygienic requirements for appliances, bulk milk tanks, as well as butchery equipment. We tried to deal with all of the situations that had come up over the years. Next slide, please. Thank you, that's the one. So in terms of that, all food premises except those controlled in terms of the Meat Safety Act must have a certificate of acceptability in order to function as a food premises. This does not mean you can then continue to render a service. You also need to comply with any other requirements that are required for a business to have in the country. So for example, the business license would also be issued by the local authorities generally, but in this lockdown situation, you had to register on the DTI webpage. In terms of the certificates of acceptability, we had always had the recurring clause that said anyone issued under 99 would also be valid under 2012. But in terms of 638, we said we gave a year's grace. So from the 22nd of June 2019, all premises must have a certificate of acceptability issued in terms of these regulations. We've also added requirements for the transport of meat after the abattoir. It's not specifically for meat between a retailer's depot and a retailer's shop, just to clarify that. So the next slide is an example of a certificate of acceptability issued by Ekurhuleni, a municipality on the East Rand. And so the new thing is that it must have 2 signatures issued by the local authority as well as the environmental health practitioner or the inspector that inspected the premises. Next slide, please. What does the COA allow the local authority or the regulations allow? The local authority can prohibit the handling and transportation of food. So if they find any hazard that is not conducive to making safe food on those premises, they can prohibit the handling or transportation of food. And then the Act allows for other state actors to be authorized in the event that they also need to ensure compliance. And that sections is dealt under Section 10 of the Foodstuffs Act. The local authority can also issue an exemption. So if a retailer or company that is manufacturing wishes to be exempted from any of the provisions, they can apply for those. So definitely like a street food trader would not be able to comply with all of the requirements that are listed in regulations 5 and 6 for the COA. So the local authority will then exempt those requirements in the situation of a street food trader, for example. It must always be displayed as practicably as possible, including the vehicles that are part of the food business that is operating. However, there's a caveat to this. For a company that uses its own vehicles, those vehicles must have the COA for the premises. if it is using it for pre-packed foods. And then if perishable goods are being outsourced, the transport of outsourced perishable products, those vehicles must then have a certificate of acceptability. So please note the difference. Then the new thing that we added is that the person in charge must have accredited training. And I know that has caused a lot of questions in terms of what does accredited mean. But we needed to ensure that the person in charge knows what he's supposed to be doing for him to be able to implement the regulations that are required. Also, we've created a requirement for document control, that all processes must be documented. We've also had a requirement for a recall procedure to be in place and to ensure full traceability of all stuff that is handled on the premises. So then I thought I'd just go into some slides on the regulations that are specifically related to persons, because we were dealing with occupational issues here. So Regulation 10 deals with the duties of the person in charge. And as I've mentioned already, they must now have training, because they've got to ensure that all the regulations are adhered to, together with the other critical requirements that are listed under Regulation 10 that they must ensure. So for example, they must ensure that the food handler is trained. Okay, and under Regulation 11, we set out what the duties of a food handler are. And so those are the issues that they need to be trained in. And this also sets out what the food handler is responsible to do, including personal hygiene, as well as disease reporting. Then Regulation 9 deals with personal protective clothing. Next slide, please. So critically, that's the regulation dealing with, again, the caveat that I've mentioned: keep clean. Clean protective clothing and personal hygiene is to prevent food from being contaminated. So just always bear in mind that these regulations are ensuring that food does not become contaminated from the environment or from the food handlers that are being used to prepare or manufacture those foodstuffs. However, some of the requirements may contribute to reducing the risk of any other communicable disease like COVID-19. Next slide, please. So in terms of the Regulation 10, what is the person in charge supposed to do? He's supposed to have had his training. He's supposed to document processes and records and have records for cleaning and the documented processes of how the cleaning is done. It must also have processes for pest control and how it is done, effective wastewater disposal, etc., etc. He must also train workers and ensure that they adhere to the facility hygiene matters. So depending on the circumstances, you would have specific hygiene protocols for your situation in question. And he or she must also ensure that they adhere to personal hygiene requirements and matters. We also specify that they're not supposed to wear jewelry, smoke in the work area, or spit, etc. So those are personal things. And then they don't handle ready-to-eat foods with bare hands unless it's impractical. And we then specify that good manufacturing practices must be followed. We don't then specify that gloves must be worn, because gloves in of itself can present a hazard in a food safety environment. That it is not critical for a food handler to wear gloves. Next slide, please. Then the duties of a food handler are specified in Regulation 11. The food handlers may not handle food if he has a sore, a suppurating abscess, so a pussy abscess, a cut, or any abrasion, or any infected skin lesions, unless they are covered firmly with a moisture-proof dressing. He may also not handle food if he's suffering from a contagious disease that is transmissible through food. So we're not saying that because he's COVID, he cannot handle food. He cannot handle food being positive with COVID because he's going to be a risk for his workers beside him, not for food. So the conditions that we look for in terms of what is transmissible through food, it's about reporting signs and symptoms. So your food handler should know about these and what these symptoms are. What is jaundice? If he has jaundice, he must report that he has jaundice, and then he is moved to something or he's put off sick. Vomiting, diarrhea, fever, discharges from the ear, eye, or nose, and a sore throat with fever. Now, this sore throat is not new. It's not something because of COVID. This is sore throat with fever, usually associated with other infections like staph, etc. We do not require medical examinations for food handlers. We require a medical examination once they've presented with these symptoms, and therefore he must have a medical certificate from a doctor saying that he may resume handling food after he's been assessed if these symptoms have gone away. Next slide, please. Then in terms of the washing of hands, it's supposed to be regularly done throughout the working day, and then we specify especially during specific times. So before each shift, before handling any food, after handling raw food, especially raw meats, chicken, eggs, and before he handles a ready-to-eat food. The new proviso is after handling an allergen, so that he does not cause cross-contamination in the allergen setting. And the one thing I think that people have not picked up in the regulations is after handling money. So the requirement that now some supermarkets have put in where the food handler, which is the lady at the till, she's also moving food between the consumer and the packaging. She's also handling food, so she's also a food handler as per the definition. And so therefore a sanitizer should have already been there for them to sanitize their hands, because obviously it's impractical for them to be washing their hands after handling money each time. And they can then also just sanitize the consumer's hands as well. Then we also have a proviso, sorry, Jeanette, after any risk that could pose a risk to contamination of the food. So that's that whole all clause, because some of these things might not have been covered. So next slide now. So in summary, I've said that the food control in COVID-19, the existing rules always applied and still apply, and the regulations of the FCD were not necessary to update. Because, as Dr. Volmink also mentioned, currently there's no scientific evidence that food or food containers poses a risk of transmission of COVID. Then you also have your environmental norms and standards that fall under the Health Act, and those are prescribe how often the EHP is supposed to visit a food premises and other premises that they also cover. Just to mention, the EHP does not only come to your premises to deal with food. He wears a number of hats. And I've heard people calling me to say the EHP has said the food handler must wear gloves. So I said, under what piece of legislation is he asking that? If it's under the Food Act, let's talk about risk and let's talk about hazards. But he said to you, it's under occupational health. Therefore, it's not about posing a risk between transmission of something from the food handler to the food, but it has more to do with this heightened concern that we have around person-to-person transmission of the COVID. The next slide then just overemphasizes again that food control and the same rules apply. The EHP norms and standards still apply, but they've also issued guidelines that then speak to issues around workplace readiness, etc., etc. But as you have heard, the Occupational Health and Safety Act, 1993, not 94, as per that on the right of the slide, is yet to deal with the workers and to ensure prevention or reduce person-to-person spread. And if the piece of legislation doesn't cover it, it will then be promulgated under the Disaster Management Act 2002. So that's when you'll have special directives being issued under that act. And that's the reason we have not had any specific directives issued in relation to food control, because the same rules apply. So that in conclusion is my almost last slide, is just to say before that, the FAO, together with the World Health Organization, so FAO is Food and Agricultural Organization, sorry, they deal with food production. World Health Organization deals with food safety, and they've jointly developed this guidance, COVID and food safety guidance for the food businesses, and it was interim guidance issued on the 7th of April. So that covers by and large what I've mentioned in terms of ensuring the whole re-emphasis of keeping clean in your premises. But they also speak to the issues around social distancing. Well, not social distancing, it's now social distancing in the workplace, sorry. So the distancing in the workplace, as well as it speaks to a bit about the use of gloves. So just the last slide, please, Jeanette. Just want to speak to it. I know my colleague from the Department of Employment and Labor gave you thorough directions on how to get to his legislation on their webpage. So this is just the slide there for you to make sure that you can go to that slide, and it gives you the actual steps on how to get to our legislation. So that is my final slide, Jeanette. If you can just put the next one for contact details. After this one, this is just to say thank you to everybody. And those are the contact details for those of you who don't have contact details for that. Thank you very much.
And at this point, I want to say thank you very much to Mrs. Penny Campbell, who has very effectively dealt with the question of food control. She is the Director for Food Control at the National Department of Health. And on the screen there, you just saw the important contact details. So thank you very much, Penny. We much appreciate that. Are you still online? Can you still hear us? Okay, so our next guest is dealing with the regulation of chemical disinfectants and respiratory equipment. I now welcome Ms. Thando Magolego from the NRCS. Can you hear us, Thando?
Yes, I can hear you. Good
Oh,
morning.
lovely. Just a reminder, I'm not sure what device you logged onto. Please just stay close to your microphone so that we can hear you throughout your presentation. My colleague Glenn is about to share the screen for your slides. And if you need to move between slides, just to tell us next. So thank you very much. Please proceed.
Okay, you can hear me properly?
Yes, we can. Thank you.
Okay. So I've been asked just to talk about your chemicals and your respiratory protective equipment and how we regulate that. And basically, I think for this audience, what's more important is how you identify what's been approved so you can use it, and how to identify what we look for when we are approving these products, so that you get an understanding of what protection you'll be getting from these products. You can move to the next slide, Jeanette. Okay, so just to give a brief scope of what we regulate in terms of chemical disinfectants. Now here I need to make a distinction. We regulate, as the NRCS, chemical disinfectants to be used on inanimate surfaces. So we don't regulate disinfectants for use on animal tissue, human tissue, or plant tissue. This is just on inanimate surfaces, right? So the definition that we use of a chemical disinfectant comes from the South African National Standard 54855. Now, in the VC, we look at chemical disinfectants that make public health claims. Those are covered. So your public health claims would be, it's a virucidal, a germicide, an antibacterial, a bactericidal, or sanitizer. We've listed all of those in the compulsory specification, and those are available on our website for anyone to go read what that is. What is excluded is antiseptics, chemical disinfectants that are exclusively used for veterinary areas, and any treated articles or substances. Treated articles, substances, we're referring to wipes, your scorers which are impregnated with a chemical disinfectant or other products. We don't regulate the wipe. We would have dealt with the actual liquid chemical that's the wipe is treated with or impregnated with. Next slide, Janet. Okay, so the compulsory specification for chemical disinfectant has been in effect since 1999, but we have a new review that was published in 2017 that came into effect in October 2019. Now, the changes in that review, basically, we've added information for manufacturing plants, warehouses. We need to know everywhere where the disinfectant is being manufactured, distributed, or stored. We've made the SDS a requirement, and we've made it that it must satisfy the requirements of SANS 11014. So your SDS must have information as per that South African standard for it to comply. We've added requirements for the bill of materials for the packaging material, because we've taken into account that the chemical will react to the material being stored, that it's being stored in. So the material becomes very important. So we've added that we need to know exactly what material is on there and whether the material is acceptable to store the chemical that you're selling. We've added changes onto the label, what's required on the label. And then there's new requirements on testing. There's standards added specifically for the quality system that's required for medical areas, because your disinfectants would be used in the food industry, in the medical industry, and in the medical industry, we don't go into the high risk areas. So your operating theaters and devices that are going to be used on humans are not covered. It's your general hospital areas, your receptions, your cleaning of the floors and things like that. That's the medical area. Food areas, domestic and industrial areas. So it's for the four of the areas that we cover. And the test reports must cover the public health claim that you are making. So if your chemical disinfectant is used against viruses, you need to test for the specific virus. And for your label, the label needs to specify exactly which virus it kills. So the microorganism needs to be specified on the label. So if your disinfectant, for instance, is against TB or COVID-19, on your label, if you've tested it and you've proven efficacy against that, on the label, you need to specify that it can kill against COVID-19. And this needs to be tested and proven for us to approve that chemical disinfectant. Okay, next slide. Okay, so the requirements on the compulsory specification are stated, and the current chemical disinfectants that have been approved to the prior version, the 1999 version of this compulsory specification, are still valid. So those products can still be used. We are currently busy with updating those approvals. So everyone is required to resubmit their application and resubmit the information as per the new requirement of VC 8054 2017 version, so that we have the SDSs, the correct test report, the quality systems where it's required, and all of that. And that process, the current suppliers who are registered have until October 2020 to have moved over to the new requirements and comply to the new requirements. Next slide. That's just the number that we will put on the label of the disinfectant. So if it has that registration number there, then you know and have comfort that that product is approved. So the product would most likely provide you the protection that it says it provides. This is the new number. The current number, you'll see an Act 5 or an Act 29 number on there. That's the numbers that are now going to change to this new number. Next slide. Okay, so this is just to explain that what we're looking at when we're looking at the packaging requirements for the chemical disinfectants. We're looking at things like breakages of containers, leakages, spillage handling, storage, and transportation. Those are the things that we look at, and these are the things that after we have approved the product, we would have received all the information on the packaging, the SDS and everything. After that, we send out inspectors who go and do surveillance inspection, and they go to retail, they go to the warehouses, they go to the manufacturing plants. And this is what they would look for then. They would look at the packaging and they would look at all of these things for compliance. Okay, so this is what I was saying, that you must be specific on the microorganism that you can kill or your disinfectant works against. And we do look at equivalent standards that are equivalent to the standard that we've specified on the compulsory specification. And we can do your approval based on that if those standards satisfy the requirements of the standards that we've specified. So if it's almost an exact match of what we require, we would give approval for that. For that, the supplier, manufacturer, or importer will also need to give us a declaration from the test laboratory that tested to that particular standard for us to accept. Okay, and then before I go into the, before I go into the respiratory protective devices, I just need to explain that we do not, as the NRCS, regulate hand sanitizers. We've been asked to produce a compulsory specification. We did produce a draft. The draft is currently at the DTIC for review by the minister and to take a decision on whether he's publishing that compulsory specification or not. We await to hear from him what will happen. If he approves the compulsory specification, as it's written currently, he would publish it, and we've asked that it be effective 7 days after publication. But at this point in time, that's not the case. So what sanitizers need to do if it's for general use, except for medical use, which SAHPRA would give licensing for that. For general use is they need to comply to a South African National Standard 490 and the marking requirements of the Legal Metrology Act. And if you comply to that, you would be acceptable to use that hand sanitizer. It would not have an approval from the NRCS because we don't regulate them currently. And then when it comes to respiratory protective devices, we as the NRCS at this point in time, in terms of PPE, only regulate respiratory protective devices, safety footwear, and that's it. The rest we don't regulate yet. So when it comes to respiratory protective devices, we have what we call medical masks or medical respirators. Those fall within the ambit of SAHPRA to issue licensing for the facilities that produce those masks. The standard that they use for that is SANS 1866. Now, SANS 1866 has two parts. Part one is the medical mask, what you normally refer to as 3-ply surgical mask. That's part one. NRCS does not regulate those masks at all. Those masks go directly to SAHPRA. Part two of SANS 1866 covers what they call medical respirators. Now that's where your N95s, KN95s, FFP2s, FFP3s fall in. Now, those have a dual mandate. NRCS covers the particle filtration part of it, and then SAHPRA would license it for the biological filtration efficacy part as a medical device. Now, next slide, please, Janet. Okay. Now, if you look at what we regulate as the NRCS, which is the FFP1s, FFP2s, FFP3s, and other respiratory equipment. You'll note here, I mentioned that we don't cover, the compulsory specification was drafted in 2011. In 2011, SANS 1866 had only one part, and it was just medical masks. In 2018, the SANS was reviewed and it came out in two parts. And part two is the one I'm talking about. So for part two, which are your N95s, your KN95s, from China, it's called KN95. From the US, it's N95. If it's coming from Europe, it's called an FFP2 or FFP3 or FFP1. They're all similar things. The standards that those masks need to comply to are EN 149, which is for particle filtration. In South Africa, the SANS equivalent to that is SANS 50149. And then for the medical respirator part, they also need to comply to a biological filtration standard. So on Science 50149, we're looking at aerosol, dust particles, and that's the efficacy that we measure the filtration against. And then when it goes over to the biological filtration, then it's blood splatter and other biological matter, and mostly in liquid form, in liquid droplets as an aerosol as well. So that's the two differences. So that's what we look at to make sure that the masks comply. Next slide, Janet. Okay, so the definitions of what a respiratory protective device is in terms of classification. In terms of a definition, we'd look at SANS 50132. It will define and give you pictograms of what the different respiratory devices are. In terms of classification, we look at SANS 50133 and SANS 50134. Next slide, please, Janet. Next slide. Okay, so these standards that I refer to here are the standards that are picked out of the compulsory specification that are most relevant to the COVID-19 pandemic. So you have your full face mask. Mainly these full face masks would be in high risk areas in hospitals. You wouldn't need to use this mask in a general setting. Half masks and quarter masks, mouthpiece assemblies can be assembled onto the half mask and quarter masks. Particle filters also can be attached to the half masks and quarter masks. Your filtering half mask, which is SANS 50149, is the one that everyone is wearing now. On the streets, you find people. This is the compulsory, this is the standard that it's tested against. Next slide. Okay, so we would approve a mask and we would not assign a number as we do on the chemical disinfectants. So this is the tricky part with the masks. It hasn't been made a compulsory requirement for the masks to be marked with an NRCS approval number. What is required is that the masks must be marked with the standard that they comply to, and certain other information like your model number, the date it was manufactured, and the lifespan, sorry, the lifespan of the mask. Next slide. So this would be the process of getting approval for the mask. So they would submit a file with the information required that proves compliance to the requirements of the compulsory specification and whatever relevant standard that the mask needs to provide to comply to. And then we would do our internal checks. We do allow for an opportunity to correct whatever non-compliances we've identified when we're doing your examination of the application. These include retesting. This applies to both chemical disinfectants and masks, basically to anything that we regulate as the NRCS. So we do give an opportunity for the applicant to go correct the non-compliances that we've identified, including retesting, including, for instance, for masks and chemical disinfectants, labeling and markings are key to the safety of the product. So we do allow them to go rework their labels to comply and what needs to be there. So those would be the type of non-compliance corrections that they would go back and do. And then we'd re-examine. If the product does not comply to the requirements, we would reject the product. And normally, if it's imported, once it's rejected, we can send the product back to country of origin. We can have that product destroyed so that it's not available for the public to access. And then if it complies, then it would get their approval. Next slide, Janet. Okay, so currently with the pressure being experienced because of COVID-19 and needing to provide this PPE and the chemicals for industry and everyone else to disinfect, we have in the NRCS Act a provision where if regulated products don't fully comply to the requirements of the compulsory specification, we can issue them with what is called in the Act a sales permit. Now, a sales permit is a temporary measure to be able to sell or supply a product that's regulated, that's not fully compliant. We have regulations published on how we process sales permit applications. And most of the N95s, K95 masks that are coming in are not fully compliant to the compulsory specification, and mainly because of the markings required. So we would look at that under a sales permit application. And what we look at when we look at sales permit applications is the non-compliances must not compromise the performance of the product and must not compromise the health and safety of the public and environment. So if you don't compromise those and your non-compliances are more of an administrative nature, a sales permit would be considered to be issued and you can sell. Sales permit is temporary, so it has conditions and it has a time frame on it. Next slide, please. So a process of a sales permit is similar to a process of approval. The difference is there's a committee. So in terms of approval, your full homologation, it would come to myself. I would assign it to an inspector. We would do our evaluation. The file would come to myself to do a review of the inspector's evaluation and recommendations, and I would make a final decision of whether we reject or issue the approval. For sales permit, after my review, it would go to a committee. The committee includes our legal department. It includes our subject matter specialists and technical specialists. And then I would be presenting the file, and the file would be deliberated in the committee and a recommendation would be made to the CEO. The CEO then would take a final decision of whether we reject or we issue a sales permit. He would consider the recommendation of the technical committee. Next slide. And I think that's it. Thank you.
This is Ms. Thando Magolega from the NRCS, that's the National Regulator for Compulsory Specifications. We are about to close, and unfortunately, we do not have time for the Q&A session, but there's one question that has been repeated so many times, and the repetition is to do with the PPE provided by the employer and the maintenance and cleaning of that. And I thought we'll just ask Warren to quickly just deal with that question only. The rest of the questions we'll deal with through the normal procedure of uploading frequently asked questions to the website and circulating where that is required. Warren, just on the question of PPE maintenance.
Okay, yeah, so it comes basically down to the risk assessment. The PPE that you're going to provide, is it worth to maybe dispose of it, treat it as hazardous waste, or are you going to take the route of maintaining it, doing the laundering of it? Obviously, both the regulation, your hazardous regulation for hazardous biological agents, and this directive refer to laundering of contaminated PPE. Obviously, it cannot really leave the workplace because you don't want further infection at people's homes and in public transport areas. So, as an employer, you need to decide whether you're going to use an internal facility to do it. Then you need to capacitate your facility in order to provide that laundering service. Or if you're going to then decide to outsource, you need to then identify a appropriate service provider who's going to do it, as well as ensure that there isn't any or spread of infection between your workplace and their employees as well. So yeah, it needs to be done. It was what was a part of the legislation. So I think each employer needs to look at their specific circumstances to decide how best they're going to address it. Either are they just going to dispose of it, or they're going to look at laundering it.
And cloth masks that may be provided by the employer, will that be the responsibility of the employer or the employees?
If it's to use at the workplace, then it will be the employer's responsibility to look after, as well as for the laundering, but as an employee, you still have a responsibility to look after and maintain your own PPE that's been issued to you. It's the same with safety shoes, overalls. It's technically just on loan to the employee from the employer.
Well, thanks for that, Warren. And at this point, I need to say thank you to Warren Mullen from the Department of Employment and Labour. Thank you, Warren, for your contributions, as well as Mrs. Penny Campbell. Are you still there, Penny?
Yes, I'm still here.
Well, thank you very much to you too from the National Department of Health. And then Ms. Tando Magolejo, are you still there? Thanks.
Hi, yeah.
Yes, thank you very much to you. And to the three of you, as well as Dr. Odette Volming and Dr. Tanusha Singh, just quoting one of our participants in the Q&A bubble box. This is Lulu Damari saying she's not asking questions, she's just offering a compliment. Thanks to all the presenters for the detailed information presented, and then she follows up asking whether the presentations will be made available. Yes, they will all be on the website, and where there are information that we need to add, we will do so. And then somebody's comment just popped up at the bottom of the screen. The email address is info@nioh.ac.za. info@nioh.ac.za. I want to say thank you very much for joining us today on the National Institute for Occupational Health. You can see the banner here behind me. Our Zoom webinar today, focusing particularly on the employees in the food industry. And a great thanks also to my colleague Jeanette Mangani for playing a huge background role in putting all this together. Goodbye.